Very good morning to you all. In today's Apollo 24/7's Health Hour, we are going to meet a very rare specialist in child's health, a pediatric endocrinologist. Dr. Subrata Dey is going to join us very shortly in a live session. We are going to talk about a child's growth and developmental issues like type 1 diabetes or thyroid imbalances, which might affect their growth and overall health also. So how do you identify these signs and symptoms very early so that you can help the child? Let's understand these complicated issues in simple terms. Joining us at 11 a.m. is Dr. Subrata Dey. See you there.
From the 1st of May, vaccinations are starting to be available in India to all people above the age of 18. The question that most people are asking is, which vaccine is more effective and which one should they take? To answer this question, let us first understand two terms: vaccine efficacy and real-world vaccine effectiveness. The efficacy of a vaccine is evaluated during a large-scale clinical trial. The trial is divided into two groups. Half the participants in the trial are administered the vaccine, while the other half get a placebo. Over the course of time, scientists calculate how many of the participants have contracted COVID-19 from both the placebo and the vaccine groups. If all the participants who tested positive for COVID-19 are in the placebo group, then a vaccine would have 100% efficacy. But if out of 10 positive cases, 9 test positive from the placebo group and 1 from the vaccine group, then the efficacy of the said vaccine will be 89%. Various factors determine the efficacy, like the duration of the vaccine trials or the different virus mutations in circulation at that time. There are 3 approved vaccines in India currently: Covishield, Covaxin, and Sputnik V. They are all based on different platforms but are fundamentally equivalent in that they help the body produce powerful antibodies and offer a similar safety profile. In clinical trials, Covishield has demonstrated an overall efficacy rate of around 70%. Covaxin has reported 78% and Sputnik V has shown around 91% efficacy. The other way to measure how a vaccine is helping to control the pandemic is to analyze real-world effectiveness of vaccines, which looks at how the virus affects people who have already been vaccinated. On the 21st of April, the Indian Council for Medical Research said that a mere 2 to 4 people out of 10,000 who got vaccinated with either Covishield or Covaxin had contracted COVID-19. This number indicates how well the vaccines are working in preventing infections. But it is also important to note that the vaccine may not always prevent an infection. What it really does is minimize the risk of getting seriously infected and getting hospitalized. Real-world data of the Sputnik V is also impressive, suggesting that it is 97.6% effective against COVID-19. Another encouraging insight came from 2 studies conducted in India by the Institute of Genomics and Integrative Biology and the Center for Cellular and Molecular Biology. According to these organizations, both Covishield and Covaxin have shown positive results against the Indian double mutant variant, which is contributing to the current rate of infection. Preliminary results of the studies have revealed that vaccinated people who were infected with the double mutant strain were experiencing only mild illness. It is quite clear that vaccines are the most effective tool against the coronavirus, which will eventually end the pandemic. Therefore, it is important that all eligible people get vaccinated when it is their turn. All vaccines that are approved are effective and safe and will protect you and your loved ones from this dangerous pandemic.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar and welcome to Apollo 24/7's Health Hour. This is an initiative by Apollo 24/7 where we bring you experts every week to your doorstep, bringing you a live session where you can interact and ask all your questions. In this session, you can type your questions in the chat box. We shall be answering them very soon. Today, we are going to talk to a very, very niche specialist in pediatric health, a very senior pediatrician who subspecializes in endocrinology. Dr. Subrata Dey from Apollo Hospitals, Kolkata is going to join us very shortly. We're going to talk about managing growth and development issues and hormonal issues in children like obesity, diabetes, mental health, and other growth issues. We are going to take up your questions as well. This show is going to also have a health quiz where you can win prizes from Apollo 24/7. Please do wait till the end of the show where we're going to give you away coupons as well. So let me start the show by asking if you are vaccinated. If you are vaccinated, very well. If you have somebody in your family who still needs to be vaccinated, go ahead, take that one step ahead, or anybody that you know, please tell them that they need to get vaccinated. No more waiting, no more hassles. Everything has become now easy. Vaccinations for India, Apollo is coming forward to vaccinate the entire population. There's an interesting drive happening at all Apollo facilities. So please go ahead, book your vaccination slots on Apollo 24/7 platform. For this, you just have to download the Apollo 24/7 app. You can click on the book vaccination slot and then choose more than 200 plus vaccination centers. Select the vaccination, whichever the one that you want to, and that's it. You are vaccinated. How do you do this further? The easier way is to scan the QR code which is on the screen, or there's a link which we'll leave for you in the chat box. You can type the link and that's it. You can get your vaccination schedule. Let me start this show today with a wonderful initiative that I wanted to share with you. The initiative is called Saving a Child's Health Initiative, which is called SACHI. This is started by Apollo Foundation, and the platform which is taking it forward is Apollo 24/7. Here, we want every child in India to be fit and healthy. The future generation needs to be really hale and healthy. And that's why Apollo Foundation has brought this wonderful program out in consultations, in combination with all the pediatricians who work with Apollo, most of the pediatricians who work with Apollo facilities. They give you free pediatric consults for every child in need. SACHI, that is Saving a Child's Health Initiative, in association with Apollo 24/7, is on a mission to make quality healthcare accessible to underprivileged children at no cost. So this is a great boon for all the children across India. More than 10 pediatric specialties can be accessed through Apollo 24/7's platform of online consultation. Renowned Apollo pediatricians will be there, free of cost. If you know somebody who requires help and who cannot afford such super specialty pediatricians, Apollo is here to help. Sachi is something that you can all promote. And here's the QR code which you can scan and know more details. Do take care of our children, and let's start today's discussion, which is also relating to children. Let's understand our children's growth and development. Joining us now is the expert pediatric endocrinologist, Dr. Subrata Dey, who works at Apollo Gleneagles Hospital, Kolkata, and who's one of the rarest pediatricians in India, who's a pioneer pediatric endocrinologist of Eastern India with over 25 years of experience. He specializes in treatment of diabetes, thyroid, obesity-related ailments in children. He's the HOD of academics at the Apollo Institute of Postgraduate Pediatrics, principal investigator in various global multi-centric trials like type 1 and type 2 diabetes. He's a recipient of a Preceptor Recognition Award from University of Kentucky. It's our honor to have you on the show, Doctor. Namaste, Dr. Subrata Dey, and welcome to the show.
Namaste, and namaste to all the viewers from Apollo family. And I will have the privilege to be addressing all our viewers on this Sunday morning, trying to little bit draw the outline of the services we provide and what kind of children we take care of. And I'll be very happy to field any questions, concerns, clarifications as we go along.
Wonderful. So let me start off with asking, we understand that pediatrics is a specialty where we always have been thinking that growth and development have to be with a pediatrician. But now I understand that endocrinology, which is the hormonal health of children, is also a very important subspecialty which we need to take care of. What are the growth and other developmental signs or issues that one can understand? And what are the issues that can contribute to growth and developmental issues?
I think that's an excellent question. And I just want to emphasize that monitoring of growth, development, and physical development is really the purview of the pediatrician. And there's a huge role they play in picking up any laggards early. And what we basically provide is a support when the patient is detected to have a growth problem. So to take it further, if your child has growth failure, has obesity, has early maturation, delayed maturation, meaning puberty happens early or late, if they are having, recent history of going to the bathroom and lots of urination, drinking lots of fluids, losing weight, this is a sign of early signs of evolving diabetes. Typically type 1 diabetes, but it may happen in type 2 diabetes as well. And this is a very important message for the parents, that if your child who was very well now looks tired and is going to the bathroom a lot, passing lots of urine and drink lots of fluids, beware, this may be the evolving diabetes, and you must pick it up early, because if you pick it up late, the child may have serious consequences. Similarly, right now there is a major trend of weight gain or obesity. Historically, Indians used to be malnourished, but now we are going the other way around, and children, because of improper dietary practices, lack of exercise, are gaining weight. And most importantly, with the background of type 2 diabetes in India, which is rampant, children are developing type 2 diabetes very early. So these are some of
common,
the...
Doctor, in children, which is the most common one in children? Type 1 diabetes or type 2 diabetes, or how is it different from the regular, the adult diabetes?
That's an excellent question. Actually, in the past, the term used to be juvenile diabetes. And that was a term which was interchangeably used with type 1 diabetes, because most children ended up having type 1. And type 1 diabetes is where you cannot produce enough insulin, and it is insulin deficiency. And there they need insulin. There is no role for tablets, no role for pills. And without insulin injections, there is absolutely no future for these children. But now, over the past decade or so, as I had mentioned earlier, with the background of, uh, you know, type 2 diabetes in adults, in fact, India is considered to be the diabetes capital of the world. Children, their children, because of the strong genetic basis of type 2 diabetes, when they uh, become obese or they do not exercise enough, and it can precipitate type 2 diabetes. So the numbers of type 1 diabetes, to give you uh, the numbers from the last is current about 3 years ago, there were 140,000 type 1 diabetics in India, which was second only to United States. Type 1 diabetes, 140,000 in India. That was 3 years ago count. And now I encounter at least 5 to 6 new cases every month. And this is type 1. But type 2 is also going up. When I first started, maybe when I came back from the US and started practicing in Kolkata 14 years ago, I would hardly see maybe 2 or 3 type 2 diabetics in a month. Now I see several. And in fact, the interesting part, and this is if there, in case there are any physicians attending this, that please don't jump and start treatment. Please do some basic tests like thyroid, like diabetes antibody test, like GAD65, and do a C peptide before you start the management, because in type 2 diabetics, the C peptide is normal, whereas in type 1, it is low. So, to answer your question in short, type 1 is still rampant, but type 2 is catching up.
Right. So, doctor, you were mentioning about the obesity and also the lifestyle changes that children are, could be pandemic or other influences which have bombarded us in the recent times. Do I understand that obesity or other hormonal issue or the other issues that we are talking about are only because of lifestyle, or there are other physical hormonal issues that we need to look out for?
I think that is again a very, very pertinent question, because uh, in the past, whenever a child was overweight, people would jump and think of endocrine causes, and there are several endocrine causes, in which there is Cushing's disease, hypercortisolism, and then there are other causes like pseudo hypoparathyroidism. Then there is Prader-Willi, Lawrence-Moon-Beadle syndrome. But now, if you look at the sheer numbers of obese children, they are usually because of exogenous causes, not endocrine. And one clue is, if your child is tall and overweight, it's likely to be simple obesity because of dietary issues. And one point about the dietary issues, when we were growing up, basically we were all, given a balanced uh, Indian diet. There would be rice or chapati, there would be vegetables, there would be dal, and if you're non-veg, maybe a small portion of non-veg. But today, the child's diet is run by TV ads. Every day you are bombarded with, all kinds of fancy junk foods, and the child, for lack of any better things to do, is watching TV. And moment he sees that yummy food, he says, I want that. And the parents in nuclear families, they basically say, okay, if this will keep the fellow quiet, then let me go and get all the nice,
Right.
tasty junk food.
It's
And
a
of
trap.
course,
It's a trap.
it's a trap.
It's a trap.
And the other point is, which I was mentioning earlier, we used to, when we were growing up, and I was doing my DCH 35 years ago in CMC Vellore, we used to see only malnourished children. But now we see malnourished children, children who go to malls. And so maybe one good side effect of the pandemic has the malls were closed for a bit, so they didn't go and have their pizzas and burgers. But having said that, they are not to be outdone. So now they Swiggy in the pizza and burgers. So the malnutrition continues. So the short story is, the message is the Indian balanced diet. And many years when I was in the US for a long time, obesity was rampant. And when I came here in the last 14 years, India is not to be outdone. They have caught up. And there are around, the conservative estimate is 20% of the urban Indian population is overweight to obese. And this is a dangerous trend. And the pandemic has
Right.
just compounded it, because they've been sitting at home, eating extra meals, no exercise, no going out.
Right. Doctor, as you've mentioned, pandemic, let me understand the fears of the third wave hitting children. And also, I'm more worried about children have been indoors for a very long time. It has taken a toll on their physical health. You know, they are doing online sessions, their pressures cannot go out. And the kind of eating, as you've mentioned, has gone really very different. Patterns have gone different from each household. So, how do we understand that the pandemic, not just the health issues, also has other serious health and mental issues?
Absolutely. It is a total disaster because, as you rightly said in the beginning, I'm first a pediatrician and then a subspecialist. And the worst hit are actually children with chronic diseases, chronic comorbidities. These obese children are getting more obese. The type 1 diabetics, lack of exercise, the sugars are going up. The type 2 diabetics, the control is getting worse. The important thing, the most important mental health impact has been, they are friendless, they're sitting at home in the four walls, and mostly parents are working from home too. And there's a constant, same old, there is no change in variety of their life, and they feel cooped up and they are becoming aggressive. And parents are also a little bit frustrated because they can't also continue with the normal lifestyle. And all in all, the children are either very subdued or very aggressive. And I have a strong message that sometimes, we have to make the best of what we have. And so use this opportunity to spend some quality time with your children, educate them on issues beyond just their books, interact with them, try to get to know them better, discuss, a wide range of things, play games with them, indoor games, if you will, and you must ensure that at least 30 minutes of aerobic physical activity. And as India is the land of yoga, in fact, recently we had in June the International Yoga Day. So these are the times when you can inculcate a lot of the Indian values in our children using this
Right.
downtime and quality family time.
Right. So, doctor, as we were understanding that children are also impacted by certain endocrine and other comorbid conditions like thyroid issues or diabetes, which can be actually detrimental for their development. But also understanding that we are going through a pandemic time, how is COVID going to impact this group of children, especially who are vulnerable?
Actually, it is a common knowledge, and I thank you for asking that very good and pointed question. It is common knowledge in the scientific community as well as a lot of the lay people that diabetics are, in the adult age group, more prone to severe COVID disease than uh, normal healthy people, and that is because of this, ACE2 inhibitor, ACE2 receptors, wherein the COVID actually attaches, and the severity of COVID in adults is enhanced by underlying hypertension and type 2 diabetes. Now, that holds true for children as well. Now, type 2 diabetes for sure is in children, makes them more prone to severe disease, COVID clinical disease, even type 1. I mean, initially we thought type 1s are probably a little different, but even type 1 diabetics more prone. But the only saving grace, and which is why even in the third wave, our children, a vast majority of them may not fall that sick, is because this ACE2 receptor is not present in younger children. It's only above age 12 and above that it presents. And so, as the child grows older, they become more prone to actual clinical COVID disease, but not the younger people. So, my one request to the government and the powers that be, and also to the Apollo chain, that when it is COVID vaccination is cleared for children, please consider the diabetics as a priority group to give them the vaccine first, knowing that there are so many children in India, and 30 to 40% of our Indian population are young, they are below 18 years of age, so it'll be a major task. But I think we should prioritize COVID vaccines when available, and is when it is cleared for children, that the diabetics be, and likewise even the obese children are more prone for more severe disease. So for the obese children, the main thought for the parents is you must address obesity in your children ASAP with lifestyle modifications.
Right. Doctor, as I'm talking to you, I'm also looking into the chat box to see what are the questions which are presented today. Most of
Sure.
us as parents, I understand we all worry about growth in our children, and the growth we all measure in weight and height. So before I ask a lot of questions which are related to growth and weight and height, let me understand what is normal growth weight pattern, height and weight growth pattern, and what is not, and what is abnormal, and what are the signs to look out for? Because
I
Shweta
think,
is, yeah.
yes, I think that.
Shweta's question is 1 year baby born, newborn baby having less growth in height. Please suggest what tests to be taken. So, what is less in height, and what is actually good to go?
Terrific. And there, I think for our lay audience, I will give you some broad parameters. Um, at birth, you are about 50 centimeters, a normal term birth. You double your height at 4 years, and you triple your height at 12 years. In other words, 50 centimeters at 1 year, 100 at 4 years, and 150 centimeters at 12 years. Now, how does a child grow? So basically, they grow 25 centimeters in the first year. So 50 centimeters at birth, 75 at 1 year, and then second year they grow 12.5 centimeters, third year 7 centimeters, and from there on till puberty you grow at 5 to 6 centimeters a year. So if you're growing less than 4 centimeters a year during that period, it is absolutely a red flag. And the most important thing is that growth in the first 2 years is driven by nutrition. From 2 to 12 years, it is driven by growth hormone and thyroid hormone. And around 12 years, when puberty happens, you basically have, excuse me, thyroid, growth hormone, and sex hormones. So it's interesting that a man is 13 centimeters taller than a, a, a woman because of the difference in growth that they have at puberty. And coming to the question which was asked by Shweta, the answer is as simple. The answer is don't go for tests, go for measurement. Insist that every time you take your child to your pediatrician, kindly at least 3 monthly in the first year, 4 monthly in the next 2 years, and 6 monthly thereafter, insist that a length or a height is taken. Up till 3 years of age, you take up to 2 years of age, you take lengths, and beyond two, you take heights. but it should be taken in an expert fashion, which is very simple. Somebody you train can do it. So to answer Shweta's question, if the baby has grown, uh, about 20-25 centimeters in the first year, growth is fine. Now, there are a variety of growth charts available. IIP has a growth chart, and a lot of parents nowadays are measuring their children and plotting on those growth charts because they are available on the net. So, first thing is a clinical evaluation. If the baby's height or the child's height is dropping off the charts and crossing centiles, that means growth is slowing. And that is what one of the main messages I have for you, that when you go to your pediatrician for your vaccinations or routine visits or even sick visits, at least in intervals of 4 to 6 months, you must get a height taken and plotted. And parents who feel that their child is not growing, they must insist that the length or height is measured, because if you can pick up growth failure early, you can treat it, because otherwise it is too late. As a pediatric endocrinologist, I get children, girls who are 13, 14, boys who are 15. Suddenly they're woken up and they find the time is past. And there are a variety of causes. Growth hormone deficiency, you can have hypothyroidism, you can have chronic illnesses, you can have celiac disease. So the point is, it is very simple. Measure the height and weight plotted on the chart. And if you find that the growth is not adequate, then then have your pediatrician look into it. And then if they need help, then specialists like me are available to try and sort things out and institute treatment early. Because, the old
At this
saying,
point, yeah, at this point, to continue your information, Mr. Prashant's question is about something similar, because he's already having a 12-year-old son. His height is only 3 feet 8 inches. Suggest some syrup or medicine. So this is what every parent thinks, that I need to add something. Is this the right approach?
absolutely not. As I told you, first 2 years, it is mainly nutrition. After 2 years, if your child is not growing, we look at a lot of things. We look at the parental height. Sometimes parents who are not that tall themselves, there's nothing wrong with not being too tall, but they will look at their neighbor's child and say, look, he's so tall. Why shouldn't my child be as tall as him? So, height is also a genetic thing. And the main emphasis is on growth failure. If your child is not growing as well as he should, as is shown on the growth chart. Now, 3 feet is 36 inches plus 8 is 44 inches. So 44 times 2.5, 88. No, he's short. He's short. He needs to be evaluated. In fact, 24/7 is the platform where you can certainly try and look for some help.
Mr.
Or
Prashant, please do look out for tests which consult a pediatrician, or especially doctors, whether they can be reached out on Apollo 247 as well to consult. And the other question, continuation to height, is Mr. Shashi Prem. I hope you got your answer. He keeps asking us here on the platform, son is short and looks fat. Any medications on children's height increase? And also, there is another question of, are there hormone injections to increase height?
I think, all these are very pertinent questions. Now, as I mentioned earlier, if your child is overweight or obese and is tall, it's likely to be dietary induced. But beware of the short and fat child, I'm sorry to use the word, overweight child, who is not growing, because they most likely have a hormonal disorder. Hypothyroidism is a major cause of lack of stature and increasing weight, and so is Cushing's disease. So beware of the short, overweight child, because there can be a hormonal basis. And again, the answer to that is you have to plot the growth. And the reason it is important to pick it up early, they're eminently treatable, and there can be permanent damage if you don't pick it up early. So again, going back, monitor growth, And some parents are very, very astute. They actually line up the child along the wall and they measure the height. So the message to them is your child from age 3 to 11, 12 should be growing at the rate of 5 to 6 centimeters a year. If the growth is much more than that, if it is too rapid growth, then there is a problem, and I'll come to that in a minute. To answer the
Right.
question, if you have growth hormone deficiency, there also you are short and overweight, plump, and you have to do a series of tests there, make a diagnosis, do a bone age, do a growth hormone dynamic tests, and they can be treated with growth hormone. And if you do not treat them, they can be very, very permanently short. Similarly, in hypothyroidism, you just have to give a thyroid pill and they start growing. But the message is monitor the growth. If your child is not growing well but gaining weight excessively, there is a problem. Now, growth hormone deficient children do wonderfully well with growth hormone injections. It is indeed available in India. In the US, it is the same growth hormone is far more expensive. So they have a subsidized rate in our country. It's freely available, and it can change entirely the destiny of the child if it's picked up early and is treated well, because the child is deficient in the hormone. Now, conversely, if the child is growing too fast, like yesterday, I saw a 6-year-old girl. She walked in, and I saw the age 6. But all these years of looking at patients, I said, this girl height looks like 9 years old. And yes, the height age was 9 years. And so I just knew. And I had one look at her chest. I said, is your child developing too early? Yes, sir. How did you know? So this child was growing excessively. A 6-year-old girl looking like a 9 years. When I did the physical exam, which is called sexual maturity rating, and I found that she physically was like a 12-year-old, and she could start having periods very soon. And it's very important to know, especially in boys, if they have precocious puberty, there can be some brain um, defect, there can be a brain tumor, there can be a hematoma, and even in little girls when they present very early. So that has to be picked up and it is treatable. So this 6-year-old was behaving like a teenager because she's full of female hormone. So we have to restore the childhood back to that child by stopping the pubertal progression. Because if you don't do that, they are early bloomers. They'll grow very tall, but they'll stop growing in a couple of years. So by age 8, she's finished growing, and she'll have periods within 6 months. Imagine a 6.5-year-old child having periods. She's still a child, so immature. So that is why these things have to be picked up. You cannot say everything is all right. Nowadays, things happen early. The pet thing which a lot of the gynecologists have conveyed to the parents is that no, nowadays girls have puberty early, but that's not entirely true. And yes, it's a little earlier than before. So, growth, I think, is the most pivotal issue in a child. I mean, what is basically different between a child and an adult? Because a child has all these stages from a caterpillar to a pupa, and then you have the butterfly. So this transition period is called puberty, and during this time you have to pick up if it is happening early, not happening at all. So in a girl whose breast development starts before 8 years of age, abnormal. Periods before 10 years of age, abnormal. In a boy, testicular development 4 cc's or more before 9 years of age, abnormal. Similarly, delayed, if a girl shows no signs of puberty at age 13, abnormal. If a boy does not have any testicular enlargement, which is the earliest sign of puberty in a male, then that is abnormal. You need to consult, at least a pediatrician should evaluate, and if necessary, consult a pediatric endocrinologist. So
Right.
the
So,
pediatrician
Dr.
should
Kaur,
really pick up most of these things, and we are there to help.
sorry, Sri Radha Rajaraman is asking this question. My son is 11-year-old. When will his adolescent changes start? and how to know if the changes are normal. So, in continuation with your signs and symptoms, I wanted.
I think that's a very, very perceptive question. Just remember, the earliest development of sign of puberty in a male, unfortunately, is a little subtle. It is testicular enlargement, 4 cc's or more. There is something called an orchidometer, which I've tried to make available to the pediatricians I know, and they're like a string of beads. So in males, the onset is often missed, but basically the cadence is as follows. First, the the testes start enlarging, then the penis starts enlarging, then there's some hair and down there, and after that you will find, in that progression, you will find that the child will start having a growth spurt, then you will have a little fine facial hair, and then you will find a voice change. So at 11 years, a boy typically will not go into puberty. They usually start at 12. As you know, boys have their puberty 2 years after girls. So girls typically start around 11, and boys somewhere between 12 and 13. So
Okay.
the best thing to do, if I were to give you a very, very simple measure, if you take a little ruler, a 6-inch plastic ruler scale, the length of the testes, when it is beyond 2.5 centimeters, that means they've gone into puberty. And that is something which is doable, but I would encourage the father to do that because he's a boy after all.
Okay. So, next question is, Mr. Manocha. What is the risk in IUGR babies regarding future obesity, diabetes, and metabolic diseases?
Oh, I think that's a brilliant question. Is there a
What's
doctor?
IUGR, doctor? I am not sure.
IUGR is okay.
What is IUGR, doctor?
IUGR is intrauterine growth retardation. You see, when a baby doesn't grow well inside the womb, it's called intrauterine growth retardation. Now, India, as you know, vast majority of India are rural, and a lot of them have, malnourished mothers, and it used to be a transgenerational cycle. Small mother, malnourished, small baby, small girl child, and then she's also malnourished, and they perpetuated that. So what happened is, these IUGR babies, when there is not enough nutrition in when the baby is growing in the womb, the body, what it does is it shuts off the different places which mops up the glucose, like the muscles, liver. So they become insulin resistant, just so that the glucose is available for the brain to grow. Now, when these babies are born, they are now at a different milieu. They look very, very undernourished, scrawny, thin. Parents want them to grow in a jiffy, and they have a voracious appetite. So these babies are given a lot of formula feeds, and everybody wants their baby to look like the Amul baby. And these babies who are already insulin resistant, and then they are fed, studies have shown that these children, if they're obese at 8 years of age, then they have severe insulin resistance, which in turn causes premature adrenarche, which is, hair in the private areas early. They get, if they're girl child, they can have precocious puberty, and they can have then develop, obesity, and they can have PCOD and a lot of metabolic consequences. And the
So basically,
sad part is,
that group
yeah,
is vulnerable, and we need to watch them out, right, doctor?
and
That's
actually
what.
for them, breastfeeding is the best feeding, because if you
No.
feed them too much in the first year of life and they gain weight rapidly, they definitely are predisposed to diabetes again in the adolescence and the host of these other problems which I mentioned. But the sad part is, even today in 2021, well, these are 2020 statistics, that 45% of our children born are small for gestational age or IUGR, and this is where the maternal nutrition comes in, and maternal good obstetric care and folate and vitamins and good nutrition. So
Okay.
it is
So,
prevention is the most important thing.
right. Doctor, as I'm coming close towards the end of the session, there are a lot of other questions too. So may I request you to condense the answers so that I can ask more questions from the audience as
Sure,
well?
sure. Absolutely, absolutely.
Atul Kumar's, yes, question is, a 2-year, 4-month-old child does not speak, conveys on non-verbal basis, makes eye contact once you do or say something of his interest only. Please suggest the measures to take. Any tests?
Well, my first point is that nowadays, first thing, bring it to the attention of your pediatrician. It's very important. Second thing is, if the speech is not developed by, now 2 year, 4 months, at 2.5 years, you must consult a speech therapist. Now, this point about eye contact is very important because, and there I think a good pediatrician or a developmental pediatrician should be immediately brought into the picture, because this could be normal. This could be a child who is slightly introverted, but this could also be early signs of autism. So it is not something which you can just let by, uh, but from your side, be very interactive with the child. Try to engage the child in conversation. Do not give televisions or your handsets for them to look at mobiles and things like that. And speak to them, sing to them, read to them. But keep in the back of your mind, it could be a harbinger of something little more grave.
Right. Dr. Lalita's question is, a child is born with hypothyroidism. Is this congenital hypothyroidism treatable? What are the outcomes?
100%. Congenital hypothyroidism is from birth. There are lots of causes, but the commonest cause is a problem with the thyroid gland. Either it is small, dysgenetic, or ectopic, or aplastic, which is not there. And there is also a condition called dysharmonogenesis. Now, the important thing to remember, there is nothing to do with the mother. It is very important to do newborn screening. And for any doctors on this show, especially pediatric doctors, I'm sure they're doing newborn screening. If not, they should start ASAP. And if newborn screening is not available, at least do a thyroid test, TSH, at 3 days of age to make sure the thyroid hormone, the thyroid gland is functioning well. It's very important to know that if you do not pick it up early, permanent brain damage can happen as early as 3 to 6 months of life, and they should be picked up by 14 days and treatment instituted. And this is something which the developed countries have newborn screening, which is universal, and this is something which is yet to pick up in India in a big way. I know private institutions, especially the Apollo family, we have been doing it across pan India, but this is a practice which should pick up. And parents should now insist that the baby's thyroid test is done either by newborn screening or by blood test at 48 to 72 hours of age. If not treated,
Okay.
it can have permanent brain damage.
Right. There are two questions related to height, Doctor. Ms. Monisha Ghosh asks, husband and her a very tall 12-year-old son has height of 4'11" and weighs 32 kgs. He is looking very thin, but in his puberty, is it okay or should I get him checked?
Uh, what is his weight now?
The weight is 32 kilos. He's 4'11", 12-year-old.
Okay. If the parents are tall, 4'11" is 48 inches, 59. So that is about 150 centimeters. I think it's okay.
Oh,
Both height and weight are okay.
nice.
Yeah, especially if the parents are tall. Yeah.
Okay. So there are genetical factors too, which we should not be ignoring. Short, height.
100%. 100%. If the parents are short and the child is short, it's called familial short stature. If the parents are tall and the child is short, then beware. You must investigate, and the way you know is to plot the child's height serially on the growth chart and see if he's dropping off the centiles. If he's following a good centile along the mid-parental centile, then the chances are the child's growth is fine. But having said that, this is a prime responsibility of the pediatrician to assess growth periodically and to reassure the parents. And of course, as I said, if the parents feel they need more specialist input, then clinicians of my genre are there. We can access locally or even through the Apollo website.
All right. Doctor, here's a question from Mr. Muralidhar Rao. Our daughter, who's aged 13, is 6 feet tall and weighs 95 kilos. Advise exercise and diet to reduce her weight. This is one question. And also, Mr. Raj R asks about the obesity, which is related to the junk food and growth issues in children. So, diet and
Six
exercise.
feet, 6 feet tall is actually quite something. But even a 6-footer weight should not be more than 78 to 80 kilos. So it'll be between 75 and 80. So if the child is overweight, so I would suggest dietary management. And most important thing is at least 45 minutes of vigorous physical exercise, because obesity in an adolescent can cause a host of other problems. It can cause non-alcoholic fatty liver disease. It can cause, that you'll see some black marks on the sides of the neck. And they can also have, period problems. They can develop polycystic ovarian syndrome. So take this weight very seriously and try and get her into a healthy lifestyle. And there are some medications one can use. There is a medication called Reshape, which blocks the entry of fat from the intestine. But these are all to be done under medical supervision. So consult your doctor. And as far as the junk food, and yeah, that's a no-no. I think you go back to the Indian balanced diet, where half the thali is rice, and then 25% is no, sorry, half the thali is vegetable
Vegetables.
and fruits and this thing, vegetable,
Protein.
and then 25% protein, 25%, 25% is carbohydrate, and half the thali should be basically vegetable, salad, as well as fruits. So that should be the distribution. And in the junk food, what happens is 95% is fat and carbohydrates, and 5% is something else, and they're very, very calorie dense. As you know, pizza, one slice of pizza has 300 calories, and small pizza, one slice only. So imagine a pan pizza probably has about 800 calories, and children eat a pan pizza just like that, and some will eat a whole pizza. So I think the main message is go back to your roots, go back to the Indian balanced diet as we used to have when we were growing up. And the other thing is, don't keep eating. Eat. My father used to say, get up from the dining table when you're still a little bit hungry. If you eat till you're sated, then you have, you are going. And remember these statistics: below 6 years obesity, about 15% of them become obese adults. 6 to 12, 30%, and above 12, adolescent, 50% of them will become obese adults. So obesity in childhood is not to be, blown away thinking they'll all be fine when they grow up. That's not going to happen, especially if your adolescent is overweight. They'll become obese adults with a slew of problems, from metabolic issues to heart disease, atherosclerotic heart disease, to gallstones, uh, you know, type 2 diabetes, you name it, and you're prone to all that.
All right. So, Doctor, here's Mr. Prasanna Kumar's question. My son is 2-year-old, 76 centimeters of height. Doctors think it could be hypoachondroplasia. So, will this be treated? I'm sorry for that misspell, but you must be
No,
understanding.
hypochondroplasia, there are certain facial characteristics. 76 centimeters in a 2-year-old, we don't know what the parents' heights are. The clue in
But if you
hypochondroplasia,
can type in your height and parents' height, it will be helpful. Yeah.
yeah, the thing about hypochondroplasia is they have actually small upper arms and small, thighs. So their limbs are short. So that is, a pediatrician can examine that very upper segment, lower segment ratio, and find that out very easily. And if they are having a doubt, then you can do a skeletal survey, or you can do a genetic test, because a skeletal dysplasia panel is available, and one can detect if there's a gene defect. But again, I emphasize, go back to your pediatrician, ask him to do the measurement. If the upper segment is greater than the lower segment considerably, then you suspect hypochondroplasia. It's a clinical diagnosis, so if you find you need more expert opinion, then look for that expert who can clinically tell you in your neighborhood. Otherwise, we have, our Apollo 24/7. So,
Right. So, Doctor, there are other questions which are again falling into the same genre of height, weight, and
mhm.
the regular pediatric questions, which I don't think is the right platform to take. So,
Hmm.
I
Hmm.
will conclude the questions from the chat box. But I want you to please tell us the gravity of obesity and type 1 or type 2 diabetes, and how do we prevent and get our children back into normal health in this pandemic, especially.
See, basically, the gravity of type 2 diabetes cannot be understated. As I told you initially, type 2 diabetes among adults is rampant, and if their children become obese at a young age, they are prone to type 2 diabetes. And so it is lifestyle, which is healthy eating and proportionate eating, balanced diet, and most importantly, 30 to 60 minutes of exercise daily. Especially beware in this pandemic situation, because here everything is on a go slow mode, lot of eating, no exercise, and this is something which is preventable, because type 2 diabetes typically happens in the 40s and 50s. Now we're seeing in the teens and even in the first decade. Type 1 diabetes, unfortunately, uh, it is difficult to prevent it, but you can pick it up early, because if you pick it up late, then they will come in coma. If you pick it up early, when the early signs of drinking a lot of fluids, going to the bathroom a lot, losing weight, at that stage, if you pick it up, just do a urine test, simple urine test. If the urine has sugar, that's diabetes. Go to your doctor, do some blood tests, fasting, PP, do a C peptide and GAT65, and start the child on insulin if the C peptide is low. But don't wait till your child goes into coma, because at that point it is a very difficult challenge and there is risk to life and health. So,
Right.
the most important message is that obesity in India is on the rise, paradoxically, even though a lot of malnourished people are there in the rural areas, and this epidemic is also as much of a scourge as the COVID, because it doesn't kill immediately, but it kills slowly over time. And I think this is something in childhood, if you pick up and are very vigilant about it, then you will prevent
Right.
them getting adult obesity.
All right. So to conclude, doctor, I would want you to give me top tips of the growth parameters. What are the signs and
Yes.
symptoms that one has to watch out for?
So the top tips are as follows, and this is rapid fire. Firstly, monitor your child's weight and height when you go to your pediatricians. At least the height to be monitored every, 3 to 6 months. See if it's being plotted on the growth chart, not falling off the growth chart. If it does, then consider it to be growth failure, and ask the pediatrician to look for causes. And if you are concerned, you can consult a pediatric endocrinologist. Number two, insist on newborn screening, especially of thyroid of your newborn baby at 48 to 72 hours. And newborn screening is available a lot of places, but if not, get a thyroid test done, TSH, at 3 days of life. Third, if your child is drinking lots of fluids and going to the bathroom a lot, then beware, it may be evolving type 1 diabetes or type 2 diabetes, and get it checked and treated early. Number four, that if you have uh, a child who is gaining weight but not growing, consider endocrine problems like hypothyroidism, growth hormone deficiency, and or could be syndromic. And these children can be treated if picked up early. If a child is tall and overweight, it's likely to be simple obesity. But important thing again, there is something called a BMI chart, and if the child's BMI is more than 85%, then it is overweight. More than 95%, it is obese. And these BMI charts and growth charts are available on the IP website, and you can download it easily and do it on your own if you should you want to. Other thing is that pubertal issues should be picked up early. Earliest sign of puberty in a girl is breast enlargement, and if it happens before 8 years of age, abnormal. Consult your doctor. And if it menarche, that is periods, happens before 10 years of age, it's abnormal. Be aware of that. In boys, testicular development 4 cc's or more, or 2.5 centimeters or more before 9 years of age is abnormal, immediately consult a pediatrician or a pediatric endocrinologist, because this could be serious. Then the other message is, if in a girl by 13 years there's been no breast development, it is delayed puberty. And in a boy, if there's been no physical development till 14 years of age, that is also abnormal. The other thing is that type 1 diabetes is, we can provide care here in India on par with anywhere else in the world. We have all the gadgets. We have, insulin pumps, which slightly expensive, but you can maintain blood sugars at an absolutely normal level and have a hemoglobin A1C of 7.0 or less. And I think the most important message is that monitor your child's growth and development and consult your pediatrician if there are concerns, and should there be any lurking doubts, consult a pediatric endocrinologist. And lastly, in this pandemic situation, please keep the home environment healthy, because mental health in the children is being impacted with so much pressure, with online classes, no friends, cooped up in their houses. And you must provide an avenue for active exercise. I keep saying spot jogging or yogic exercises, yoga, and balance the diet and keep the environment at home very, very nice, congenial, and lively. And with that, I would like
Thank
to
you, Doctor.
conclude and thank you for your very patient viewership. And I
Wonderful,
thank
Doctor.
our
Thank you.
hostess, Ms. Jhansi, for having expertly steered us through this
Wonderful,
hour.
Doctor. Thank you. Thank you for your precious time and your expertise as well. Wonderful having you on the show once again.
Namaste.
Thank
Namaste.
you. So now is the time that audience, you can answer the questions that I have on my hand and win prizes from Apollo 247. I'm going to ask you 3 questions and you have to answer the questions in the chat box. Type your answers there and I'm going to announce the winner's name towards the end of the webinar. Winners, if you are declared, if I announce your name as a winner, you have to send your contact details right back to us on marketing@apollo247.com and gift vouchers will be shared with you. So get ready. Quiz mein aaj ka question number 1. It's going to come up. How many bones are babies born with? Newborn babies have a different count of bones, not the adults. So listen to my question carefully. Once again, I'm repeating my question number 1. How many bones are babies born with? Simple question hai. Agar answer pata nahi hai to, secret. Google kijiye or get me the answer. Question number 2 coming up. Which type of diabetes is more commonly found in children? Type 1 or type 2? There are only 2 options. Which type of diabetes is more commonly found in children? I repeat my question once again. Which type of diabetes is more commonly found in children? Type 1 or type 2? Now, question number 3 coming up. Which option on Apollo 24/7 app allows you to get medicines and other essential items delivered at your doorstep? Which is that feature or which is that option on the Apollo 24/7 app that you can go on to and get medicines or other essential items delivered at your doorstep? Answer pata hai to type kijiye, nahi to aapka Apollo 24/7 app open kijiye, see where that feature is and do type the name in the chat box. I see that there are a few answers which are already here. In the meanwhile, let's talk about COVID care package. While India is going through COVID pandemic, we understand that households are going through COVID, but recovery from COVID also needs expertise. So during COVID-19 and beyond, here is Apollo 24/7, which is making your recovery easier. COVID care package, which has 3 doctor consultations within 30 days and 7 days of chat access with each appointment, is coming only at 599 rupees. So you can handle your post-COVID symptoms easier with Apollo's expertise. So to get these COVID care package details, which are on Apollo 24/7, you can scan the QR code which is on the screen, or we can leave a link to the Apollo COVID care package in the chat box as well. Do go ahead and take care of yourselves. So the winners for today are Mr. Narsimharaju Dichpalli, Srujana Tota, and Ravi Bharati. Congratulations, winners. Please do write back to us at marketing@apollo247.com. Thank you so much, all of you, for joining and asking your questions today. And here are the gift coupons, as I've announced before. Use coupon HH247 to get up to 199 rupees off an online consultation with Apollo doctors, and use coupon HH247 to get 15% off on medicine orders when ordered from Apollo 247. Please do log on to Apollo 247 app to use these coupons. Thank you so much. And before I leave and take leave from you all, I would want to remind you all of the Saving a Child's Health initiative, which is an Apollo Foundation's initiative on the platform of Apollo 247, where you can underprivileged children अगर कोई है और जिनकी pediatrics की ज़रूरत है, free of cost, Apollo Foundation is doing this. So I would want to show you a great video on this. Please do spread the message, and may the children of India be strong and healthy. Thank you one and all. Bye-bye.